So my name's David Woodger and I work at Goldsmiths. Training youth and community workers on undergraduate and master's programmes, and mainly my focus of work has been around race equality, as well as thinking about learning and ways of really embedding understandings in learning and teaching that have some meaning and impact for leadership and action. So my work has primarily been interested and focused on structural inequality, and in particular looking at racial inequality, and both work in the field, community work, community development, research and teaching on this subject. And I suppose the area which I've particularly focused in relation to that is around institutional racism. I guess really the area in which I think has the most significant impact and an everyday experience for black and white people, and so that's been my area of interest. My own journey in some respects has been one which began very much seeing that the way forward was political change or structural change, primarily around this area, and that would be sufficient or enough to make a difference. I mean, I'm not dismissing it now, but I think over the years I've come to understand through my experience that in looking at many pieces of work that I've done around looking at institutional racism, that at the heart of it there's so much work to be done with people who need to explore and been able to have the space to look at and examine what racism is and start to understand that at a level that connects to them to start with. And so often I feel that that's been missing in the discussions and the debates. And so for a large period of time, up until quite relatively recently, in some ways the focus always looking at race and racism has always been on us, the black people, to look at this issue, or that it's something connected to our lives, our pathology, our lifestyles in some way. And I think what's been missing from the debate has been any examination of white people, whiteness, white power in that dynamic, as in a way looking at both cause and effect, and in a way the causes haven't been looked at or examined sufficiently, but the effects in a sense are well known to a large degree if people do acknowledge them, in terms of the situation facing black people in fact across the world in terms of the effects of racism, be it in the public or the private sector. There isn't an area which isn't untouched by this relationship between white and black people. I guess one of the incredible barriers is first some sense of acknowledgement that it exists. My experience in so many organisations and environments is that there isn't a high degree of understanding that actually exists or is operating constantly, every moment, every day, in each organisation, and the way it delivers or markets or shares its services. And so that probably is the quintessential sort of beginning of looking at it. So in a way, this constant denial of its existence needs to be looked at and reflected upon. And in a way, it's caricatured in the sense of when you talk to groups of white people about it, that there is a sort of an amazement that it's happening or that it's taking place, and usually that it doesn't exist. And this really emanates from a lack of sense of identity on their part of being white. So in a way they're normal, and so they see themselves as normal, and there's themselves as normal, and then there's another. And the other is usually the minority, the black, in that respect. And so this work around looking at what it means to be white, what it means to be British, both in an individual, personal level, a professional level, very important, the professional level, in terms of being able to connect up what that means in terms of your professional practice, the significance of being white and privileged in that position. And then, of course, how that connects with the institutional services, if you like. And this has been, the main focus of my work. give one example, I did a piece of work for a 3-year sort of research action project with 3 health authorities, and incredible senior management, predominantly white, who agreed that they needed to look at the differential outcomes for black and white patients, and commissioned us to do this project, which was quite incredible, quite a rare opportunity to be able to examine themselves, to take some sense of risk in opening up what was, obviously quite a huge area. And essentially what we discovered was obviously the differential services so often has to be confirmed for people to really believe it. That was the first part of the work, getting some acknowledgement across the whole organisation that there was this incredible differential services, and on occasion some people dying because of lack of care from Asian backgrounds. As a result of that, of looking at that, we were then able to start to work with practitioners in a very concerted way to get them to start to look at their practice and look at what that practice meant in terms of treatments, in terms of communication, and many areas, without going into too much detail, that started to have an impact on differential pathways and services that black communities experienced, and the way that they responded very differently to these communities as separate from the white communities and patients they were working with. And that took time, because in a way this process of engagement and action enabled them slowly to start to see and reflect and look at the way they were working. And of course reflection's a difficult area of work in itself, just to be able to do that as a whole. But around the issue of race and identity, very lots of obstacles and difficulties. But with working within groups where there was, some people starting to be able to see this, enabled others to start to see it as well, and we were able to create quite a successful project, which manifested in then looking at both practice and the changes structurally that they could start to make that had meaning, that would make a difference to these differential outcomes. So I think the key for us was to really, they're the experts in doing what they're doing, and it's enabling them to come up with the solutions that would make practice different and services different in the way they were framing them to our communities. So what you've got in terms of tackling this inequality is you've got this new professional practice, this new realization about themselves and the way they operate in this norm environment, and starting to see how they could do things differently and think about the service differently. And this made incredible differences. So we met communities in that first stage, many Asian elders who was suffering from diabetes, for example, who had never accessed other related and important services like chiropody or the dietitians and other such services and related services. And we started to see a big impact in changes being made by these practitioners in their new ways of working. But again, this focus was totally about them and not problematizing the communities who were not coming to their service. So it's turning things on its head in that respect, and really getting their service to take responsibility for thinking about this issue in a meaningful way. And this brought about significant changes within the structure and the inequalities in healthcare. Small project, maybe had impact, but the impact it had in those particular services, particularly those in relating to cardio, some of the community services, some of the other oncology and a few other elder services, it had a good impact, and that was something that was able to share across other services. But of course there were other issues in maternities, across the services, across the hospital and community services, in terms of inequality. So they were starting to be able to share that learning and understanding.